A comprehensive list of interesting facts about medication. First antibiotic, penicillin, discovered by Alexander Fleming in 1928, was the first true antibiotic. Aspirin, derived from willow bark, aspirin has been used for pain relief for over 2,000 years. Placebo effect. The placebo effect can produce real physiological changes in the body, demonstrating the power of the mind in healing. Insulin, discovered in 1921, insulin transformed diabetes treatment and is essential for many diabetics. Vaccines. The first vaccine, developed by Edward Jenner in 1796, provided immunity against smallpox. Drug regulation. The FDA, Food and Drug Administration, in the US oversees the approval and regulation of medications. Generic drugs. Generic medications are typically cheaper than brand-name drugs and must have the same active ingredients. Biosimilars. These are biologic medical products highly similar to already approved reference biologics, often used in chronic diseases. Side effects. Almost all medications can cause side effects, which can range from mild to severe. Antidepressants, SSRIs, selective serotonin reuptake inhibitors, are commonly prescribed for depression and anxiety. Opioids. While effective for pain relief, opioids carry a high risk of addiction and overdose. Antibiotic resistance. Overuse of antibiotics has led to resistant strains of bacteria, making some infections harder to treat. Pharmacogenomics. This field studies how genes affect a person's response to drugs, leading to personalized medicine. Chronic diseases. Medications for chronic conditions like hypertension and diabetes are essential for managing long-term health. Over-the-counter, OTC, drugs. Many medications can be purchased without a prescription, including pain relievers and cold remedies. Adverse drug reactions, ADRs. These are harmful or unintended reactions to a medication, which can vary widely between individuals. Bioavailability. This term describes the proportion of a drug that enters circulation when introduced into the body. Pharmacodynamics. This area of pharmacology studies how drugs affect the body, including mechanisms of action. Pharmacokinetics. This studies how the body absorbs, distributes, metabolizes, and excretes drugs. Combination therapy. This involves using multiple medications to treat a single condition more effectively. Nutraceuticals. These are food products that provide health benefits, sometimes acting as a supplement or alternative to medications. Medication errors. Errors in prescribing or administering medications can lead to significant health risks. Formulations. Medications come in various forms, including tablets, capsules, liquids, and topical creams. Clinical trials. Before a medication can be approved, it must undergo extensive testing through clinical trials. Antihistamines, used to treat allergies. These medications block histamine, a substance produced by the immune system. Statins, commonly prescribed to lower cholesterol levels and reduce the risk of heart disease. Antipsychotics. These medications are used to manage conditions like schizophrenia and bipolar disorder. Mood stabilizers. Often used in bipolar disorder treatment, these medications help stabilize mood swings. Contraceptives. Birth control pills contain hormones that prevent ovulation and are widely used for family planning. Gastroprotective agents. Medications like proton pump inhibitors are used to treat acid-related disorders. Antiviral drugs. These medications treat viral infections, such as HIV and hepatitis. Hormone replacement therapy, HRT, used to alleviate symptoms of menopause, it replaces hormones no longer produced by the body. Epinephrine, administered in cases of severe allergic reactions, anaphylaxis, it can quickly reverse symptoms. Medication adherence. Ensuring patients take medications as prescribed is critical for treatment success. Drug interactions. Some medications can interact with others, leading to reduced effectiveness or increased side effects. Vaccination schedules. Immunizations are often given according to specific schedules to maximize effectiveness. Homeopathy. This alternative medicine system uses highly diluted substances, with the belief that they trigger the body's healing processes. Medication storage. Proper storage of medications is essential. Some require refrigeration, while others should be kept at room temperature. Pediatric medications. Dosing for children often differs from adults due to differences in metabolism and body composition. Geriatric considerations. Older adults may metabolize medications differently, necessitating adjustments in dosages. Side effect management. Many medications have strategies or adjunctive therapies to help manage side effects. Natural remedies. Some people use herbs and supplements as alternatives or complements to prescription medications. Addiction treatment. Medications like methadone and buprenorphine are used to treat opioid addiction. Cancer treatments. Chemotherapy, immunotherapy, and targeted therapy are commonly used to treat various cancers. Blood thinners. Anticoagulants and antiplatelet medications prevent blood clots, crucial for heart disease management. Medications in pregnancy. Many medications are classified based on their safety for use during pregnancy. Patient education. Educating patients about their medications is vital for safe and effective use. Medication management systems. Tools like pill organizers and medication apps can help patients adhere to their regimens. Drug development. The process of developing a new drug can take over a decade and cost billions of dollars. Controlled substances. Certain medications are classified as controlled substances due to their potential for abuse. Dosing forms. Medications may come in extended release forms for longer-lasting effects. Patient-centric care, involving patients in decisions about their medication, can improve outcomes and satisfaction. Telemedicine. Remote consultations allow for prescriptions and medication management without in-person visits. Digital health tools. Apps and wearables are increasingly used to track medication adherence and health outcomes. Herbal supplements. Some herbs, like St. John's wort, can interact with prescription medications. Drug shortages. Global supply chain issues can lead to shortages of essential medications. Medication recycling. Some programs exist to safely dispose of unused or expired medications. Viral load. In the context of HIV treatment, medications aim to reduce the viral load to undetectable levels. Pharmacy technicians. These professionals assist pharmacists in dispensing medications and managing inventory. Adverse effects reporting. Patients and healthcare providers are encouraged to report adverse drug reactions. Mental health medications. These include antidepressants, anxiolytics, and mood stabilizers. Narcotics. Strong pain medications that are regulated due to their potential for addiction. Medication formulary. A list of medications covered by a health insurance plan, guiding prescribers. Clinical pharmacists. These professionals work with healthcare teams to optimize medication therapy. Pharmaceutical research. Ongoing research aims to develop new therapies for various diseases. Drug patents. Medications are often patented, giving the manufacturer exclusive rights for a period before generics can be produced. Drug monographs. These documents provide detailed information about a medication, including indications, side effects, and interactions. Receptor binding. Many medications exert their effects by binding to specific receptors in the body. Chronic pain management. Medications like NSAIDs and opioids are often used to manage chronic pain conditions. Immunosuppressants. These medications are used in autoimmune diseases and organ transplantation to prevent rejection. Annual health reviews. Regular reviews of medications are recommended to ensure their continued appropriateness. Medications for heart health includes beta blockers, ACE inhibitors, and statins. Vaccination impact. Vaccines have significantly reduced the incidence of diseases like polio and measles. Self-medication. This practice involves individuals using medications without professional guidance, which can be risky. Medication therapy management, MTM, a service that optimizes therapeutic outcomes for patients. Allergic reactions. Some medications can cause allergic reactions, ranging from mild rashes to anaphylaxis. Drug compliance refers to whether patients take their medications as prescribed. Chronic disease management. Medications play a crucial role in managing chronic diseases, enhancing quality of life. Drug development phases. New medications typically go through preclinical testing, followed by 3 phases of clinical trials. Patient-centered medical homes. These emphasize coordinated care, often involving medication management. Non-steroidal anti-inflammatory drugs, NSAIDs, commonly used for pain relief and inflammation. Medication reconciliation, the process of ensuring accurate medication lists during care transitions. Pharmacovigilance, the science of monitoring the effects of medications after they have been approved for use. Cold chain management, essential for medications that must be stored at specific temperatures, such as vaccines.